Hello, everyone. Today I will be presenting my organizational change project on reducing emergency department boarding at Seattle Children's Hospital. Seattle Children's Hospital is a nationally recognized pediatric healthcare organization serving patients throughout the Pacific Northwest. The emergency department sees approximately 65,000 patient visits annually, and nearly half of all hospital admissions originate there. Because of this high patient volume, efficient patient flow is critical to maintaining quality care and supporting the organization's mission of providing hope, care, and cures. The issue I selected is emergency department boarding. This occurs when patients who have been admitted remain in the emergency department because of an inpatient bed is unavailable. Boarding creates delays in care, contributes to overcrowding, and reduces the department's ability to serve incoming patients efficiently. Emergency department boarding affects patients, staff, and the organization. Patients and family experience longer waits and increased anxiety. Staff members face heavier workloads and increased stress. Organizationally, boarding reduces efficiency, limits capacity, and can negatively affect patient satisfaction and quality outcomes. Seattle Children's operates through a multidisciplinary care model that relies on coordinations among physicians, nurses, case managers, and support services. Current challenges include limited inpatient bed availabilities, discharge delays, seasonal patient surges, and behavioral health admissions that often require extended placement coordination. There are several factors that contribute to emergency department boarding. Internal causes may include delayed discharges, communication gaps between departments, and limited visibility in bed availability. External factors may include seasonal increases in patient demand and challenges securing placement for behavioral health patients. Together, these issues create bottlenecks that slow patient movement throughout the hospital. Lewin's change theory provides the framework for this project. The first stage is unfreeze. It creates awareness of the problem. The second stage is change. It introduces new patient flow and discharge processes. The final stage, refreeze, ensures successful practices become part of the standard operations through education, policies, and ongoing monitoring. Transformational leadership is important because it focuses on engaging and motivating employees. Leadership creates a shared vision, encourages participation, and empowers staff to contribute to solutions. This approach helps reduce resistance to change and promotes long term commitment to improvement efforts. Systems theory recognizes that healthcare organization functions as interconnected systems. Delays in one department affect performances throughout the hospital. For example, delayed discharges reduces bed availability, which contributes directly to emergency department boarding. This perspective supports organization-wide solutions rather than isolated fixes. The primary goal is to reduce emergency department boarding time by 20% within 12 months. Additional goals include improving patient satisfaction, increasing discharge efficiency, and optimizing hospital bed utilization. The first strategy is implementing daily capacity management huddles. These brief multidisciplinary meetings would review census data, anticipated discharges, admissions, and bed availability. Improved communication helps teams identify and address bottlenecks before they impact patient flow. The second strategy is predictive discharge planning. Patients likely to be discharged within 24 to 48 hours would be identified early, allowing teams to coordinate medications, transportations, follow up care, and other discharge needs before the planned discharge date. Our third strategy is a real time bed management dashboard. This tool would provide visibility into a hospital census, available beds, pending admissions, and boarding patients. Access to real time information supports faster decision making and improves coordination across departments. And for our last strategy is increasing the number of patients discharged before noon. Earlier discharges create bed availability sooner in the day, allowing admitted emergency department patients to move to inpatient units more quickly and reducing boarding time. Some key stakeholders include the executive leadership, physicians, nurses, case managers, social workers, environmental service staff, patients, and families. Each group contributes to the patient flow and discharge processes. Their engagement is essential for successful implementation and long term sustainability. Now, several barriers may affect implementation. Resistance to change, staffing shortage, and high patient volumes can create challenges. Communication gaps between departments may also slow progress. These barriers can be addressed through staff education, leadership support, stakeholders' involvement, and ongoing communication throughout the change process. Now, the implementation timeline spans about 12 months. The first phase focuses on planning and data collection. The second phase involves staff training and process development. The third phase launches pilot initiatives, followed by evaluation and full implementation of successful practices. And hoping that at the end of the 12 months, we're able to reduce the average boarding time by 20%, increase discharges before noon by 15%, and improve patient satisfaction scores by 10%. How we'll measure success will be using several key performance indicators. The primary metric is average emergency department boarding time. Additional measures may include emergency department length of stay, bed turnover time, discharge rates before noon, patient satisfaction scores, and staff engagement surveys. These metrics will help determine whether the initiative achieved its goals or not. As for our expected outcomes, if it's successful, this initiative will improve patient access to care, reduce wait times, and enhance the patient and family experience. Staff should benefit from improved workflows and reduced overcrowding. The organization will gain greater efficiency, improved bed utilization, and stronger overall performances. Now, to recap, emergency department boarding is a significant operational challenge that affects patient care, staff satisfaction, and hospital efficiencies at Seattle Children's Hospital. By applying Lewin's change theory, transformational leadership, and systems theory, this project proposes a comprehensive strategy to improve patient flow and reduce boarding times. Though capacity huddles, predictive discharge planning, real time bed management, and early discharge initiatives, the hospitals can work towards reducing boarding by 20% within 1 year. These improvements will support Seattle Children's mission and help ensure children receive timely, high quality care. Thank you, and I welcome all questions.